The heart, a vital organ, tirelessly pumps blood to sustain life. Any damage to this critical structure can have far-reaching consequences, making it essential to recognize and address potential warning signs promptly. By understanding the symptoms, diagnostic tools, and risk factors associated with heart damage, individuals can take informed steps to protect their health and seek timely medical intervention. Heart damage often manifests in subtle and varied ways. Recognizing these symptoms early can mean the difference between managing a condition effectively and experiencing severe complications. One of the most telling signs of heart trouble is chest pain or discomfort. This pain is often described as a persistent or recurring tightness, pressure, or sensation of heaviness in the chest. It may occur during physical activity or emotional stress, sometimes subsiding with rest. Such discomfort should never be ignored, as it could signal underlying issues such as restricted blood flow to the heart muscle. Shortness of breath is another hallmark symptom, commonly arising during exertion or while lying flat. Difficulty breathing may indicate that the heart is struggling to pump efficiently, leading to fluid buildup in the lungs. Persistent breathlessness, especially when accompanied by other symptoms, warrants immediate medical evaluation. Fatigue, though often dismissed as a result of stress or insufficient rest, can also point to heart problems. Unusual tiredness, particularly after minimal activity, may indicate that the heart is unable to meet the body's demands for oxygen-rich blood. This symptom can progressively worsen, interfering with daily activities and quality of life. Swelling, or edema, is another concerning sign. Fluid retention in the legs, ankles, feet, or abdomen suggests that the heart is failing to circulate blood effectively, causing fluid to accumulate in tissues. This condition, while often associated with heart failure, can also result from other medical issues and should be assessed by a healthcare professional. Irregular heartbeats, known as arrhythmias, are a warning that the electrical system regulating the heart's rhythm is compromised. A heart that beats too fast, too slowly, or erratically may struggle to pump blood effectively, increasing the risk of complications like stroke or heart failure. Palpitations, fluttering sensations, or skipped beats are indicators that the heart's rhythm should be evaluated. Dizziness or fainting, which occur when the brain receives insufficient blood flow, are further red flags. These symptoms may stem from arrhythmias, structural heart problems, or other cardiovascular conditions. Finally, pain radiating to areas such as the shoulders, arms, back, neck, or jaw can signal heart distress. This type of referred pain is particularly concerning when it occurs in conjunction with other symptoms of heart trouble. When symptoms suggest potential heart damage, diagnostic tests play a crucial role in pinpointing the underlying cause. The electrocardiogram, or ECG, is a common and non-invasive test that measures the heart's electrical activity. It provides valuable insights into rhythm abnormalities, evidence of past heart attacks, and other structural or functional issues. An echocardiogram offers a more detailed look at the heart's anatomy and function. Using ultrasound technology, this test visualizes the heart's chambers, valves, and overall motion, helping to detect conditions like heart failure, valve disorders, or congenital abnormalities. It is particularly useful for assessing how well the heart pumps blood. Blood tests are another cornerstone of cardiac diagnostics. Certain biomarkers, such as troponin, are released into the bloodstream when the heart muscle is damaged. Elevated levels of these markers are a strong indicator of acute heart injury, such as a heart attack. Additional blood tests can assess cholesterol levels, inflammation markers, and other factors contributing to cardiovascular health. Stress tests evaluate how the heart performs under physical exertion, revealing potential blockages or limitations in blood flow. By monitoring the heart's response to increased demand, healthcare providers can identify areas of concern that may not be apparent at rest. In some cases, stress tests are paired with imaging techniques to provide a more comprehensive assessment. Advanced imaging modalities, such as cardiac MRI or CT scans, offer detailed views of the heart structure and function. These tests are invaluable for identifying scar tissue, inflammation, or congenital defects. An angiogram, performed using a catheter and contrast dye, examines blood flow within the coronary arteries. This procedure is particularly useful for detecting blockages that may require interventions like stenting or bypass surgery. Knowing when to seek medical attention is critical. Certain symptoms, such as severe chest pain, significant shortness of breath, or fainting, constitute medical emergencies and require immediate action. Delaying care in such situations can lead to irreversible damage or even death. Emergency services should be contacted without hesitation if these symptoms occur. Chronic or worsening symptoms, even if they appear less severe, should also prompt a visit to a healthcare provider. Persistent fatigue, swelling, or irregular heart rhythms are not normal and may indicate underlying conditions that need to be addressed. Early detection and treatment are key to preventing complications and improving outcomes. Heart damage rarely occurs in isolation. It is often influenced by a combination of lifestyle factors, genetic predisposition, and other health conditions. High blood pressure, a leading risk factor, forces the heart to work harder to pump blood, potentially leading to thickening of the heart muscle and reduced efficiency. Managing blood pressure through diet, exercise, and medication is essential to preserving heart health. Diabetes, particularly when poorly controlled, accelerates damage to blood vessels and increases the risk of heart disease. High blood sugar levels contribute to inflammation and plaque buildup in arteries, compromising blood flow. Similarly, high cholesterol levels, especially elevated LDL or bad cholesterol, promote the development of atherosclerosis, further narrowing the arteries. Obesity places an additional burden on the heart, increasing the likelihood of conditions like high blood pressure, diabetes, and sleep apnea. Smoking, a well-established risk factor, damages blood vessels and reduces oxygen supply to the heart, heightening the risk of heart attacks and other complications. A family history of heart disease is another important consideration, underscoring the need for proactive monitoring and lifestyle adjustments. While recognizing the signs of heart damage is crucial, prevention remains the most effective strategy for maintaining cardiovascular health. A heart-healthy lifestyle begins with a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Limiting saturated and trans fats, added sugars, and sodium can help control cholesterol levels and blood pressure. Regular physical activity strengthens the heart and improves circulation. Aerobic exercises, such as walking, cycling, or swimming, are particularly beneficial. Strength training and flexibility exercises also contribute to overall fitness and reduce the risk of falls or injuries. Smoking cessation is one of the most impactful changes a person can make, as the benefits of quitting begin almost immediately and continue to accrue over time. Managing stress is another important component of heart health. Chronic stress can contribute to behaviors and conditions that harm the heart, such as overeating, physical inactivity, and high blood pressure. Techniques like mindfulness, yoga, and deep breathing can promote relaxation and resilience. Regular health checkups, including blood pressure and cholesterol screenings, provide an opportunity to detect and address risk factors early. For those with existing conditions, adherence to prescribed medications and recommended lifestyle changes is essential to prevent further damage. Understanding the complexities of heart health empowers individuals to take charge of their well-being. By recognizing the symptoms of heart damage, utilizing diagnostic tools appropriately, and addressing risk factors proactively, it is possible to prevent or manage cardiovascular conditions effectively. Heart health is a lifelong commitment, but the rewards, increased energy, longevity, and quality of life, are well worth the effort. Thank you for tuning into this deep dive into recognizing and addressing the signs of heart damage. Your heart is your most vital organ, and taking steps to protect it can truly change your life. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell so you never miss out on life-saving health tips. Remember, early action and informed decisions can make all the difference. Stay proactive, listen to your body, and prioritize your health. Thanks for watching.